Hello, everyone, and happy Monday. Well, hope everyone had a great weekend. I know I did. I relaxed for a change, so that's great. We are talking about hormonal balance for women. We have talked on this subject quite a bit, but we have never talked about how Chinese medicine can help with maintaining hormonal balance. And that's what we are talking with Dr. Sara, who is a doctor of Chinese medicine as well as a functional medicine practitioner focusing on helping women like all of us maintain their hormone balance. Thank you so much, Dr. Sarah, for joining me.
Thank you for inviting me. I really appreciate the opportunity and look forward to our conversation.
Great. Let's just start. I know Chinese medicine is an umbrella that encompasses so many different things, right? It's not only the herbs or the acupuncture, there are so many other things that are part of your tools. So talk to us, what is the process if someone comes to you from a Chinese medicine perspective to help them balance their hormones?
Right, absolutely. So usually what happens when a patient calls our clinic is they will go ahead and book their appointment, and then they fill out an expanded health history. And a comment that we get a lot is that it's one of the longest health histories that they've filled out, because we ask all sorts of questions about their sleep, their appetite, their digestion, the whole gamut of things, because Chinese medicine sees the person as a whole person. It's not, you have hot flashes, we will do this for you, regardless of which patient you are. Each patient gets an individualized treatment plan. So we may have 10 women come into our clinic in a week with hot flashes, and they will each get a completely different treatment. There might be a little bit of overlap, but it's really about a whole person diagnosis. So we may choose to use acupuncture, we may use herbs, we often or almost always use lifestyle and dietary advice. Stress management is always a huge component of our treatment plan. So each person does get an individualized treatment plan and will often include multiple modalities rather than just acupuncture or just herbs. Ideally, we treat the person with as many tools as we can to get them well.
Okay, so this is a quick 10-minute session today, what we are doing. So most of us are familiar with acupuncture sessions, but we are not so familiar with using acupuncture with the Chinese herbs. I think we are more familiar with kitchen spices. Chinese herbs has a very different names. So just talk to us common herbs, common Chinese herbs that you have used to help hormone balance, and what kind of lifestyle modifications that you recommend along with acupuncture and Chinese herbs.
Right. Well, the term yin and yang that a lot of people have heard of in Chinese medicine is a really important part of how we see the body and a person, as whether or not they have too much yin or too much yang, if they're too hot or too cold. So that's a great place to start. I'll give an example of an herb that's popular these days, turmeric, which is, an amazing herb. It's really great for anti-inflammatory. A lot of people use it for different uses. But if a person comes into us and they already have excess heat in their body, that may not be the greatest herb for treating what they've got going on, because systemically they've already have too much heat internally. We don't want to add to it. So we always look at herbs as a polypharmacy in Chinese medicine. We never prescribe one herb for a particular condition. It's always multiple herbs for a person and their condition. So certain herbs that we use to regulate hormones that tend to be kind of across the board, just hormonal regulators that we would say that we use commonly are wild yam, dongui, vitex, licorice. There are a lot of herbs that we use, but we usually use them in a Chinese medicinal formula rather than, for instance, if I tell you to go out and get vitex and take it, that's just not how Chinese herbal medicine works. If you really want the beauty of Chinese herbal medicine, find yourself a Chinese herbalist to help you to regulate things. And then for maintenance, it may be easier to find a smaller formula of 3 or 4 herbs rather than a more complex formula that I might prescribe for someone that may have 10 different herbs in it.
Okay, and then along with that, so that makes sense. It's like a personalized formula, pretty much a personalized medicine, right? If you think about it, to exactly, because you're going to assess me as an example, whatever issues I might have, you're going to say, oh, a little bit of licorice, a little bit of turmeric, a little bit of vitex, versus someone else who comes might have some other kind of a configuration.
Absolutely. And there are some common herbs. We have a common herbal formula, Shao Chai San, that regulates liver dysfunction. We have Shao Yo San, which is called Free and Easy Wanderer, which helps to soothe the liver, which tends to be good when we just have some stress, some outside stressors. The liver in Chinese medicine is involved with regulating hormones. That's a nice, gentle formula that if someone pulled it off the shelf, we don't usually recommend that, but if someone did, it's kind of a safe formula for women if they're just looking to kind of take the edge off, nourish their hormones, nourish their liver, and it has a blood deficiency component to it. So if someone needs to boost their blood, they can take that. So there are formulas that I guess may be more user friendly than others, but it's just not the beauty of Chinese medicine. It's not usually how we work.
Sure. So it's not like I can take some kind of a Chinese formula tonic on a daily basis to make sure my hormones are going to be regulated, right? It's not like that, right? I can't just scoop it up and say, okay, I'm taking my greens, matcha, or, one of those kind of things. That's what I meant.
Right. So there are some tonic formulas that would be okay for a general healthy person to support their health, but usually we want to clear away any imbalances before we use that type of food-based gentle medicine. We want to make sure that we clear any excesses, deficiencies, or imbalances. And once we get you to a better place, there are some lifelong formulas that we could recommend.
Okay, so we're talking the toolbox that you're using is acupuncture, Chinese herbs, and what else? From a diet point of view, you're analyzing yin and yang. And is there different from a Chinese perspective? I'm not an expert on Chinese medicine here, but warming foods versus the cold foods. I mean, that's at least what I have read. And if you go someone else, they'll say, oh, eat salads. So I just want you to kind of explain a little bit how Chinese medicine works as far as the food and diet is.
Sure. Sure. So again, going back to that hot cold, and there's more than just hot cold, but that's a great example that's accessible to use. And Chinese herbal therapy and food therapy or nutritional advice is going to be similar in that we want to make sure that if you, for instance, have cold digestive system situations going on, we want to make sure that you're not just eating salads and smoothies. All those may make technical sense from a Western view of nutrients and how many calories you're taking in and all that. When you're eating cold, damp foods like that, it takes your body a lot of work to warm them up. And if you already have a weak cold digestive system, you don't have the fire to cook those foods within you, it'll be important to cook your foods first. So if someone does have that cold digestive dysfunction, we'll ask them to actually do more soups and things that have already been partially digested by cooking before consuming them.
So you will be analyzing someone's body's constitution, the same concept, right? They have, I think, 4 constitutions, and then according to the heat inside the body that you're going to determine, the food would be recommended accordingly, right? That's what I'm understanding.
Exactly. There's different flavors like salty, sweet, sour, bitter. All of those provide different benefits for people if they have either an excess or a deficient condition. So we really do a whole workup, and whatever your diagnosis is, we're not only going to formulate an acupuncture plan, we're going to also give you a formula, an herbal formula, and then tell you things that you can do to complement with your diet. So yes, it's not necessarily just but there's hot, cold, there's different disharmonies in different organ systems. There's a lot of different things that we look at in order to create a diagnosis.
And what are the diagnosis tools that you use to figure out what's going on in someone's body?
Right. So there are a lot of different tools that we use. The primary ones are your pulse, we take your pulses. You actually have 6 different pulses on each wrist that will give us information. And then we also will look at your tongue. So we'll look at your tongue, both the color of the actual body, the color of the coating, how much coating is on your tongue, whether there's scallops around the edges of your tongue, if there's a red tip on, if there's a red tip to your tongue. We look at the tongue to formulate a diagnosis. And that's really important because pulses can change day by day. Tongues don't change quite as frequently. So as we're getting to know a patient and we get more pulse readings and more tongue, we watch the tongue and how it responds to treatment, we can really understand what's going on in the body. If someone's really got a cold deficient system, their tongue will be really pale and maybe even a little purplish. Somebody that's got a lot of anxiety and is one of those fast-paced people that's always moving and grooving may have that red tip on their tongue. So it really helps to give us clues. And then we ask questions again about their sleep, their appetite, their sense of taste, whether they like things cold, whether they like things hot. I mean, there's so many different things that we look at to formulate a plan with a patient.
Okay, it's very, very complex as opposed to giving one pill, which our society is used to. Take it and then hopefully God help you, right?
It's the opposite of that for sure, because we're not looking to put a Band-Aid on something. And Western medicine has some amazing life-saving tools. I've had my life saved by Western medicine. I certainly wouldn't throw it out with the bathwater, but there are a lot of lifestyle diseases that if we can pick up on them before they become full-blown, let's say diabetes or a full-blown major health concern that really does need medication, if we can pick up on those imbalances beforehand, we can cultivate health instead of manage illness. And I think that is so important.
Absolutely. Well, I think this is a great example, the way you explained the whole process. And that's how we need to think about our bodies, is not that one pill, we take a pill, like we are a pill society. We want like Amazon, everything to be fixed within 2 hours. The package is arriving, so we're used to that kind of a mentality.
Right.
So we shift our mentality for our own bodies.
And that is our biggest challenge, I think, as practitioners of this medicine is it's both a beauty and a challenge in teaching our patients how to slow down and honor their body's processes and not treat it like Amazon, not treat it like we need an immediate fix, because that's not always going to serve you. In fact, most often it does not serve you to treat your body like that.
Exactly. And that's what we are trying to do, is we are here to advocate the holistic therapies and trying to tell people that this is not a one pill fix that we're going to do. It is a continuous effort that all of us have to work on our bodies, on ourselves, not only physical as well as mental and social aspect of it, to make sure that this engine is working nice and beautiful in a well-oiled machine here, right?
Yeah, you got to keep it well oiled with all the things that it needs. And, stopping at the fast food place on your way home from a long day of work with a 6-hour commute and yada, yada, yada. It's just not, you may live longer, but you may not live well with some of the tools in Western medicine. They can keep you alive, but, I have 80-year-old patients that come in, and each 80-year-old is so different as far as what choices, obviously some of the genetic things they bring to the table, but what choices they've made along the way will make 80 look a lot different for each person.
Well, thank you so much. Very insightful information. Anything else you'd like to add before I wrap up today's Monday session? This is our first Monday session for this week.
Right. Well, again, we just treat the body as a whole. And I think that's an important thing, whatever paradigms you choose to walk into, whether it's Chinese medicine, yoga, or any of the holistic health field. It's about making the connection between mind, body, spirit, and just nourishing yourself. And I love the name Nourish Doc, because that really is truly what we're doing here, is teaching people how to nourish themselves while we're obviously providing a service of acupuncture or Chinese herbs along the way. The part of I need to nourish myself is such a big, huge part of our medicine. It's a beautiful part.
Thank you. Thank you so much. Yeah, you said it very beautifully. We all have to nourish ourselves on a daily basis. So, with that, thank you everyone for your support. Thank you, Dr. Sarah, for joining me this morning. We stay tuned. Our platform is ready and live, so we are coming up with that and a lot of other cool things. So, with that, thank you.
Thank you.